Okay, so you were driving home from work or from school, whatever, and you see this poster on the door of your local pharmacy saying, "Get your flu shot." And you start to wondering again, is it the rich people are trying to make more money out of me? Well, no. You have to get your flu shot every year because the virus mutates every year, and the flu shot you got last year might not be able to protect you from the viruses that is infecting people this year. But then another question will pop up, right? How are these vaccines made? I'm injecting these unknown clear liquid into my body, and how do I know it's safe? So, we're going to talk about how these vaccines are made and why do we have to get it every year. To answer all these questions, we'll have to take a step back and let's take a closer look at the flu virus itself. The flu is a contagious respiratory illness caused by influenza virus that can infect your nose, your throat, and sometimes your lungs. And it can cause anywhere from mild to severe illness. You may be homesick for a couple days, or you might actually have to go to the ER because of flu virus. And sometimes, worst case scenario, it might lead to death. The best way to prevent the flu is by getting the flu vaccine each year. People who have flu often see some or all of these signs symptoms that is listed right here. Fever, cough, sore throat, runny nose, stuffy nose, muscle or body aches, headaches, fatigue, and sometimes vomiting and diarrhea. And it's very important to note that even if you don't have a fever, you might still have the flu. Most experts believe that flu viruses spread mainly by tiny droplets made when people's flu cough, sneeze, or talk. You may be able to pass on the flu virus to someone else even before you show symptoms, as well as after you get sick. Although people with flu are mostly contagious in the first 3 or 4 days after their illness started to show, some people, especially young children and people with weakened immune systems, might be able to infect other people with flu viruses for an even longer time. But what if I say, hey, I never got sick, I never been to a hospital in my entire life? Well, you know what? Good for you. But still, there's a chance that you might get sick. And serious problems related to the flu can happen at any age. However, some people are at a higher risk of developing serious flu-related complications if they get sick. These include people 65 years and older, people of any age with certain chronic medical conditions such as asthma, diabetes, and heart disease, or if you're pregnant or you're a young children. It is very difficult to distinguish flu from a common cold. So you will have to go to a doctor and get tested on the flu viruses. Due to the high mutation rate, the vaccine from last year will no longer protect you from the viruses that is in the environment this year. Most common way that the flu vaccines are made is using an egg-based manufacturing process. Egg-based vaccine manufacturing is used to make inactivated vaccine, usually the flu shot. The egg-based production process begins with the CDC providing private manufacturers with CVVs, or candidate vaccine viruses. These CVVs are then injected into fertilized eggs and incubated for several days to allow the viruses to replicate. The viruses containing fluid for flu shots, the influenza viruses for the vaccine is then killed under radiation or some other method, and antigens from the virus is purified. The manufacturing process continues with purification and testing. FDA will test and approve each single batch of vaccine prior to the release and shipment to ensure the safety and efficacy.